medicine has made numerous significant advancements over the past few years. During that time, our orthopedic specialists have done thousands of total knee replacements in conjunction with local hospitals. Did you know that there are over 206 bones in the human body, and that these bones, in connection with specialized tissue called ligaments and cartilage, form a structure called the joint? Joints, aided by these structures, allow the bones to move freely against one another with minimal friction. All joints rely on healthy and strong structures to sustain body weight and the impact of everyday activities. For example, imagine that the knee moves several hundred times each day in walking, climbing stairs, bending, or participating in sports activities. With this in mind, let's take a special look at the anatomy of joints.
You may ask why joints such as the shoulder, elbow, hip, knee, or ankle could be injured to the point where they require total joint replacement. The reason for this is that they're under constant demand for performance. The tissues and fibers within the joint may be injured or simply wear out with time. The most common reasons for joint replacement are persistent conditions of pain, restriction of movement, severe fractures that crush the bone and cartilage, deterioration, or destruction of the joint due to chronic arthritis or some degenerative disease such as osteoarthritis, rheumatoid arthritis, avascular necrosis, or post-traumatic arthritis.
Your surgery may take from 1 to 2 hours depending on the complexity of the case. Total joint replacement is a major surgical procedure, and as with all surgeries, there are potential complications such as the risks of bleeding, blood clots, damage to blood vessels and nerves, persistent pain, or infection within the joint. Infection can occur despite proper surgical procedure and medical treatment. Precautions include preoperative antiseptic scrubs and washings of the leg before surgery, as well as administration of antibiotics. We, your surgeons, also wear isolation suits or spacesuits for added precaution. As with any joint replacement, there is a slight chance of prosthetic failure. This may be caused by dislocation, excessive wear, or excessive weight of the patient. Overweight patients are advised to lose as much weight as possible before surgery as well as after.
The total knee prosthesis is designed to provide a normal range of motion in the patients postoperatively with respect to their bending and straightening. The expected range of motion following joint replacement surgery on the knee is for the patient to be able to fully straighten their knee and bend it to 120 degrees. Although a prosthesis takes the place of the knee cartilage, the muscle, tendons, capsules, and ligaments of the knee remain. There are several types of prosthesis available on the market today. Most are composed of metal and plastic. The metal, which makes up the femoral portion of the prosthesis, is either stainless steel or cobalt chrome. The plastic, a high-density polyethylene, is used for part of the tibial and patellar portions of the prosthesis. It moves well against the metal, resisting wear, cracking, and providing a low-friction, weight-bearing surface.
When the knee joint is healthy, it is a remarkable mechanism. The healthy knee joint is formed by the top of the shin bone, called the tibia, and the bottom of the thigh bone, or femur. Your kneecap is called the patella. Cartilage provides padding between the bones and helps assure an effortless, smooth gliding motion of the joint. The lining around the knee produces a lubricant that contributes to the smooth movement of the knee. When arthritis occurs, the knee is unable to effectively cushion the body from impact and stress. The result is erosion of the cartilage and pain that can gradually hamper your quality of life, reduce your independence, and make it hard or impossible to do the things you want to do.
Total knee replacement surgery is an excellent operation for the relief of pain. 100% pain relief is not expected due to the muscles, tendons, ligaments, and capsules remaining in their original state. However, with good results from total knee replacement, you can expect to walk into a new and expanded life of activity.